looks like we're right at noon, so we'll go ahead and get started. So good afternoon, everyone, and welcome to our Back to Basics webinar series. For those of you who have joined us before, we're glad to have you back. And for those of you that this is the first time joining our webinar series, we're really glad to have you. My name is Carrie Finley, and I'm with Superior Health Quality Alliance, and I'll be your facilitator today. Before we get started, so that everyone can have a good understanding of who's with us here today, if you would take a minute to enter your name, your organization facility, and your role in chat. That way we'll know who has joined us. Because our topic today is food bank nutrition programs, and because in some areas we're reaching 90 degrees today, why don't you go ahead and enter your favorite food that you like to eat in the summer in chat as well. And while you folks are doing that, oh, and I see Catherine mentioned she likes watermelon. Watermelon seems to be very popular in chat right now. I agree with you. Lots of delicious foods. So while you are entering that, I'll have Andrea advance to the next slide. I just wanted to share with you some upcoming topics that we have. As I mentioned, today's session is a part of a webinar series, and our webinars are on the third Tuesday of each month, and they occur at noon Central or 1 o'clock Eastern. And as you can see, our session next month will be focused on tobacco cessation, and then we will be discussing immunizations in August. All right, next slide. So at this time, I'd like to hand it off to our speaker for today. The speaker is Emily Merwin from the Second Harvest Food Bank of Southern Wisconsin Health and Wellness, and she's a coordinator for the Southern Wisconsin Health and Wellness programs. So Emily, I'll have you go ahead and introduce yourself, and I'll hand it off to you.
Wonderful. Thanks, Carrie. So as Carrie mentioned, my name is Emily Merwin. I'm the Health and Wellness Programs Coordinator at Second Harvest Food Bank of Southern Wisconsin. So I work with a lot of healthcare organizations and do some really cool programs that we'll talk about later. So I'm going to be sharing some of the work that we do at Second Harvest and sharing some strategies for collaboration between healthcare and the charitable food sector. Next slide, please. So our objectives today are to understand the link between nutrition and chronic disease and become familiar with different approaches to the concept of food as medicine, recognize the role of food banks in collaborating with healthcare entities and driving nutrition initiatives, and identify where you can find resources related to nutrition and chronic disease. Next slide, please. So we're going to start with some poll questions just to kind of get a sense of where folks are at currently in their practices or where your organizations are at. So our first poll question is, what is your organization's current food insecurity screening strategy? All right, awesome. I'm seeing lots across the board. So that is wonderful. It looks like we've got a little bit of everything. So that's great. And then we can move on to our next poll question. And that is, do you know the food insecurity rate of your patient population? Okay, lots of answers coming in. Awesome. So we've got quite a few no's, which is totally, kind of what I expected. I'll share some resources later where you can explore a little bit more about the food insecurity rates of your patient populations. So we can go to the next slide. So a little bit of background on Second Harvest Food Bank. We are a Feeding America member food bank. Feeding America is the national organization that oversees most of America's food banks. The primary role of a food bank is to source large quantities of food, and then we distribute that food to our partner food pantries. We have a few direct to guest or neighbor programs, but the vast majority of our food is distributed through food pantries to our neighbors and our guests. We serve 16 counties in Southwest Wisconsin. You can see the map here. We have about 300 partner organizations. The vast majority of these are food pantries, but we also partner with some non-pantry organizations to run some programs. So we have youth and family initiatives. We have a youth and family initiatives team. They work with schools, childcare providers, and after-school programming sites to provide meals and snacks to kids. As the health and wellness programs coordinator, I work again primarily with healthcare partners, but I also provide nutrition education materials for use in our partner pantries. And then across all of our partners, we have some food share outreach specialists who offer application assistance for food share, which, if you're not familiar, is Wisconsin's name for SNAP. And so we really try to kind of cover all the sectors where folks might be living and working. Next slide, please. So just cover kind of some basics about nutrition and chronic disease. As I'm sure we all know, poor nutrition can contribute to a variety of chronic diseases. I've listed some of them here. In addition to medications, dietary and lifestyle changes are often, quote unquote, prescribed for many of these disorders because we know that they can, have positive impacts. Next slide. Food insecurity and chronic disease. So beyond nutrition, a person's level of food insecurity can also impact their health and chronic conditions. Food insecurity itself doesn't necessarily contribute directly to the development of chronic conditions, but it can lead to a lot of coping mechanisms that do impact a person's health. Since food costs tend to be a relatively flexible part of someone's budget, folks facing food insecurity will often choose more high calorie, high fat, high sugar processed foods and less produce and high quality proteins and whole grains, just because of the differences in cost. And for folks, it's more important to be able to get enough calories and not feel hungry than necessarily to buy the healthiest options that they possibly can if that's not going to provide them with enough calories. And so food insecurity, leads to that decreased overall diet quality. It can also lead to chronic stress, which can exacerbate chronic conditions and lead to worse management overall of a person's chronic conditions. I also just want to take a step back and talk about the larger concept of social drivers of health beyond just food insecurity. Folks who are experiencing food insecurity are more likely to also be experiencing housing insecurity, transportation insecurity, and reduced access to healthcare, both physically being unable to get to healthcare outlets and also by being under or uninsured. All of these can contribute to the inability to, for example, properly store and take medications, get to doctor's appointments, etc., just because there are other factors going on. So when we're thinking about treating a person with a chronic disease, or really treating any person, we have to consider the person's entire circumstances to manage their health properly. Tests and exams are great, but unfortunately they only show part of the picture. And so that is one of the reasons that social determinants of health screenings are becoming more and more common. Next slide, please. I want to start off with a really common kind of overall umbrella type of nutrition intervention that's used for chronic disease management. So food as medicine is a blanket term. It covers all sorts of programs, but the concept is really the backbone of most of the current healthcare and charitable food system collaborations, and most of the healthcare kind of food-based interventions in general. Next slide, please. So although work has been happening for many, many years in many different sectors, the concept of food as medicine really started to take root in the United States after the Biden-Harris administration's conference on hunger, nutrition, and health in 2020. The strategy that they released as part of that conference committed a lot more funding to food as medicine research. So they're funding programs in hopes of improving the evidence base for the concept. Like I said, there's been a lot of programs going on for many, many years, but there hasn't been robust research done. And so a lot of the funding is really trying to get additional research and additional evidence to back the concept of food as medicine. In addition to food insecurity, food as medicine also aims to affect nutrition security. So nutrition security is a newer concept, and it's stemming from the fact that someone may be able to purchase enough food calorically, but not enough nutrient-dense foods, similar to what we talked about in one of the previous slides. And I also want to include just a disclaimer here on food as medicine. The concept of food as medicine is not new. It's been utilized for centuries, primarily by indigenous and Eastern cultures. These cultures believe that specific foods and herbs have medicinal and healing properties, and that the ways that the concept and the terms are used today is a little bit reductive to and appropriates centuries-old practices. So on the healthcare side of the spectrum, there's also concern that these interventions place too much blame and responsibility on the individual and their habits, rather than acknowledging the role of genetics, environment, and other factors in their health. Some folks also feel that it's misleading and that it suggests food and dietary changes can replace medicine instead of being used in conjunction with medicine to improve, again, the person's whole health. And so just some things to keep in mind. We at Second Harvest don't specifically use the term food as medicine for a lot of these reasons, but that is the kind of general term. That's the common term that folks know. And so just to provide some context there, if folks have take offense to the term. Next slide, please. So our first food as medicine-esque program that we have running is our Hunger Care Wellness Program. So every month we pack boxes of food that include produce, meat, and dry goods. We send them to 6 healthcare organizations in our service area, who then distribute those boxes to their patients. We provide recipes to complement the boxes, and the healthcare systems provide education to their participants, because again, food alone is not going to cure someone of their chronic disease, especially if they don't know how to cook and they don't have the ability or the knowledge to eat those foods in healthy ways. Food may go to waste or just not be consumed, and it's only nutrition if people eat it, is what we like to say. Participants are in the program are patients who are experiencing food insecurity and also either heart disease or diabetes or both. And so we try to target that pretty specific population because there is evidence base around heart disease and diabetes and food as medicine type interventions. Next slide, please. We are also currently piloting a new program, which we've called the Nutrition Prescription Program. This program focuses on supporting food insecurity screening and intervention processes. In addition to helping hospitals expand their screening programs, we're also co-creating strategies with them for immediate intervention when a patient does screen positive. Oftentimes what happens is a patient screens positive and clinicians, through no fault of their own, just really don't have anything to do for that patient or to give to that patient in terms of resources or knowledge or education. And so we're really trying to focus on creating programs that can close that loop and actually provide the patient with resources immediately. For all of the interventions that you see here, we've got a couple of different models that we're using. We as Second Harvest are providing funding and resources to help with food procurement. We're also helping to provide educational materials and other resources if needed, or connecting folks with other organizations who can provide those materials in their communities. Next slide, please. As I alluded to earlier, there are a lot of programs and program types that fall under the food as medicine umbrella. Medically tailored meals and groceries, pretty self-explanatory. Either meals or groceries are delivered to a patient, and those meals and groceries are tailored to their specific health conditions. So it could be diabetes, it could be kidney disease, it could be any number of conditions that food and groceries and meals can help with. Produce prescription programs allow providers to prescribe produce to patients, which then gives them access to something like to free produce via something like a CSA, a farmer's market, a grocery store, or other outlets, depending on what's available in the community. The next one is nutrition incentives, and these really vary. They often come in the form of some sort of voucher or benefit card. WIC, or the Women, Infants, and Children Supplemental Nutrition Assistance Program, is often thought of as the oldest and largest food as medicine program because it does have that nutrition component, and it aims to improve the food insecurity and nutrition security of participants. Double Dollars, which is a part of SNAP, it varies by state, but it's typically a farmers market program that allows individuals to double their SNAP dollars for use on produce and sometimes other goods at participating farmers markets. And so they can say, I want to take out $20 of my SNAP benefits for the farmers market, and they get $40 worth of vouchers to use specifically at that farmers market. So it doubles their dollars, as the name suggests. Medicare waiver demonstrations, Section 1115 are the ones that are most commonly used. They allow Medicare tools and resources to be used for care that is typically outside of what is thought of as clinical or medical care. They're currently in use for a variety of social drivers of health focused interventions, but there are multiple related specifically to food and nutrition insecurity. These can include nutrition counseling, home delivered meals, or pantry stocking, harkening back to those medically tailored meals and groceries, nutrition prescriptions, and grocery provisions for folks with food insecurity who receive Medicare. In lieu of service, similarly allows Medicaid programs to pay for services outside of typical Medicaid benefits, including services that address any of the drivers of social determinants of health, or any of the social drivers of health, excuse me. Next slide, please. So knowing all that, we're going to now move into some collaboration opportunities between healthcare and charitable food sector, taking kind of a step back from the specific interventions that we at Second Harvest are doing. When we think about the charitable food system, it really includes more than just food pantries and food banks. There are community coalitions and organizations and government programs that are really crucial parts of the fight to end food insecurity. And it's, we would not be able to do our work without those organizations and those programs. So when we think about SNAP, the Supplemental Nutrition Assistance Program, it does not have nutritional parameters on what foods can be purchased, but it is a proven intervention to reduce food insecurity. SNAP Ed is the education portion of SNAP, and it provides vital nutrition education to SNAP participants. Often, SNAP is a really great way to get folks connected to resources. You could have healthcare navigators or social workers work with patients to sign up for SNAP. A lot of SNAP Ed classes are taught at clinics and hospitals because they're really accessible places for folks to go and receive that education. And then WIC does have nutrition parameters, so it's also really effective at increasing or at addressing nutrition insecurity. And there are quite a few collaborations currently happening and starting to happen where WIC clinics and traditional healthcare are co-located. And so they can, if a patient screens food insecure and may be eligible, their clinician can send them directly over to the WIC clinic. A WIC nutritionist can come in and help the patient sign up for WIC, things like that. And so there's some really great work and some movement towards getting SNAP and WIC more integrated into healthcare. In addition, more and more often, payers are recognizing the impact of nutrition and food insecurity on clinical outcomes and on healthcare costs. Some payers have begun programs to provide produce prescriptions, nutrition incentives, or medically tailored groceries for their population. These programs often require a provider referral and are targeted towards the chronic diseases that we covered earlier, not necessarily just for food insecure folks, but for anyone who has those conditions. And so that obviously really ties right into to healthcare and that sort of thing. I, again, want to emphasize that these programs don't just have to be for food insecure folks. When we talk about the charitable food system, we do focus primarily on the food insecure population, but food as medicine expands so much farther than just food insecurity. And the charitable food system often has really great relationships with SNAP, with WIC clinics, with other community organizations and things like that, that and so that they can still be a really great partner, even if they are not directly working with folks who are food insecure. Next slide, please. So I have linked a couple of food as medicine programs that are happening in each of the states that Superior Health covers. The slides are going to be sent out after the presentation, so you can explore these links, but there's a lot going on. And a lot of work happens in silos. And so really, wanting to connect everyone and make sure that we all know what's going on so that we can refer someone to a program if we feel that they need it, and not try to reinvent the wheel and create new programs ourselves when some are already happening. Next slide, please. I also wanted to include some resources if you're interested in learning more about any of the things that we've discussed today. So I'll just run through them quickly. Map the Meal Gap is Feeding America's yearly report on food insecurity in the United States. They have a really great interactive map that you can search by state, city, zip code, and other designations of the population. The only disclaimer that I will give for this is that the data are from 2022. This resource in the report is always 2 years behind in the data. So the numbers now are likely higher due to a lot of pandemic assistance programs that have ended since 2022. But this is a great place to go if you're interested in learning about food insecurity in your community. Find Your Local Food Bank is another Feeding America resource. It allows you to type in your zip code and it will show you the Feeding America food bank that serves your location if you are interested in any sort of collaboration with them. I've also included a link to SNAP Ed if you're interested in learning more. This link leads to the federal page and has lots of information about the program and tools you can use in your practice. But SNAP Ed is a state facilitated program, so your state site will likely have more information. I don't have a link here, but your local university extensions, usually connected to the larger state schools, are really great resources for nutrition education and community connections. They are working on the ground in communities to understand their needs and address their needs. And so they can be really great, just really great connections to make. So for example, in Wisconsin, our UW extensions or University of Wisconsin extensions are the ones that facilitate SNAP Ed. And on the previous slide, some of the programs listed there are in collaboration with, for example, the University of Minnesota Extension Program. The last 3 links all contain more information about food as medicine in general. You can read more about the Department of Health and Human Services commitment to food as medicine and their framework, and about current research and initiatives that are underway. Tufts has really been a pioneer in the field of food as medicine, and their website has a lot of really great information. If you're interested in networking with folks running food as medicine programs or just hearing more about food as medicine programs that are happening, you can join the Food as Medicine Coalition. They have, I believe, monthly meetings where folks share out and there's time for conversation and collaboration. And it's a really great resource for anyone who is interested in running or is running some sort of program. So next we are going to move into brief breakout rooms to discuss these 2 questions, which we should be able to drop in the chat. Each room will have a facilitator from Superior Health, and I will be hopefully moving through the rooms as you discuss. We'll come back after about 5 minutes for some reporting out and to wrap things up. So the 2 questions are, how could your organization currently work with a local charitable food organization? And what are some barriers your organization might face to implementing a food as medicine program?
All right, we'll give everyone a few moments to return. So I think what we'll do at this point is we will go out, we'll do just a quick report out about the discussion that we had. Are there any facilitators from the breakout sessions that would like to start the conversation and what was shared?
Sure, I can. So my name is Nicole, and I had a few people in my room, and we did talk a little bit about how the first question on how people can currently work with a local charitable food organization. And one of the folks in our room talked about how they are going to start working towards like a food drive, and they are going to make it like a competition between departments within their organization to collect food and then be able to distribute that. And then we talked a little bit about how in Minnesota here there's an organization here called Super Shelf who goes into different food shelves and really makes the atmosphere like more fun by how they set up the vegetable stand in the store and the dairy area and the fruit area, and they're kind of just sort of like remarketing how food shelves look and feel. And so that's been kind of cool. And then honestly, we sort of ran out of time. We started talking about what some barriers are for that an organization might face. And then we got pulled back into this room. So we didn't really get to that.
Wonderful. Thank you for sharing, Nicole. Andrea, do you have any best practices or anything you'd like to share from your breakout room?
Absolutely, yeah. So in response to the first question, my group talked about in ways that they currently work with a charitable food organization or could do that is really providing the education around the nearest food banks local to their organization. Sounds like they have an opportunity to put resources on a wall and present that information to patients and really communicating that and what's available to them. But we did talk a lot about, oops, I'm sorry, I'm advancing my slides. We talked a lot about the barriers. And in regards to, obviously we know there's a lot of shortage in many different areas of healthcare, specifically social work was one that our group talked about. We also talked about from the patient perspective, there may be a little bit of shame and not always wanting to talk about food insecurity. So we talked about how to share that information with PCPs and, really how to talk to patients. And Emily mentioned that, she's currently developing a resource that she could share with folks on how to address that. So I think that's a great opportunity to share a resource like that with our participants here. And then a couple of other challenges that patients don't always have access to appropriate foods, especially those that might be on a renal diet. And then transportation was another barrier that was mentioned. Folks in the community don't always have a way to get to those food banks. So that was the discussion in our room.
Oh, wonderful. It's an excellent discussion. I'll just share briefly about what was discussed in my breakout room. We focus specifically on patients receiving dialysis, and they do face food insecurity and also, have specific meal restrictions and requirements that they follow. So one of the approaches that they're currently looking at is setting up food banks at local dialysis clinics. That hasn't happened yet, but they're exploring the possibility. Also looking at medically tailored meal services. We didn't get too far into barriers, except to share that, dialysis patients in particular, they are going to a lot of different appointments to manage their health care. And sometimes it is hard to focus on the meal or the food aspect of things. So very good conversations. And it sounds like everybody had excellent conversations.
Carrie, we had one more breakout room.
Yeah. Oh, we had another breakout room. Oh, I didn't realize that. Wonderful. Okay.
So I'll speak out for that breakout room. We didn't have a lot of discussion on the first question. Just an organization mentioned that they were in the very early stages of working with a food bank. So not a lot of discussion around that. The second discussion question were the barriers. And we talked a lot about, barriers of storage and, maybe Medicare requirements of having food actually in an organization that we would be sharing with patients. But we did have a share about, in the dialysis world, access to additional food, because transportation is a concern. I feel like that really comes up with almost everybody, is that transportation piece. And the access to like kidney-friendly foods to eat, and actually what is available in their home. So we could give them a list of kidney-friendly foods, but what's actually available to them. And so that obviously is a barrier as well.
All right, thank you, Casey. All right, let's move on to the next slide. Okay.
Excuse me, Carrie, there is a question for the speaker in the chat. So Emily, Sarah Weissner put a question in the chat, and it is, could you share more how-tos for connecting patients with SNAP benefits, produce prescriptions, and Medicare Section 1115 waivers, especially for Minnesota residents that she works with in the PCP office?
Absolutely. So I'll first talk about SNAP benefits. A really great thing that we do at Second Harvest is at all of our pantries, we have flyers that have the numbers that go directly to our food share, which is our Wisconsin version of SNAP, our food share helpline. And then those folks can help the individuals get signed up for SNAP. And so a really great way is, you could have those flyers in your office to offer to patients. You could include those on the after visit summary, include that information. And so the expectation is never that a physician or a nurse or any clinician is going to be the one who is directly signing the patient up for SNAP, but there are a lot of resources. I'm not familiar with the specific resources in Minnesota, but I can certainly, my email is here. Anyone, just feel free to email me, and I can certainly follow up on that, Sarah, if you're interested. In terms of produce prescriptions and other types of programs, really the best way to find programs that are going on in your state is Google. Not, the greatest answer, but there's so much going on with so many organizations that it's almost impossible to keep track. I did put a couple of links to some programs in Minnesota on one of the previous slides. One of them, I do believe, is a produce prescription-esque program. And so definitely just reaching out to those organizations and asking, hey, how can I get involved in this? How can I get patients signed up for this? Or working with your local food bank, food pantry, community coalition to identify those opportunities. For the Medicare Section 1115 waivers, I don't believe Minnesota currently has a waiver specific to food insecurity. Neither does Wisconsin, which is, unfortunate, but I know that there's constantly work being done to try to get those waivers passed in the states. And so, definitely advocating for that at higher levels is going to be a great thing.
And Emily, we have a couple things in the chat. Thank you for your beautiful answer. NP Ferrara has got a wonderful comment. And she says there is a need to remove the hideous vending machines in dialysis healthcare centers. I just lost the comment. And vending machines in dialysis healthcare units, and or have alongside those farmer fridges vending machines with jarred salads, hard-boiled eggs, apples, etc., but have the latter accept EBT cards. That could be a game changer.
Absolutely.
Do you have any comment?
Yeah, you're 100% right. There's definitely, concerns that come up with the not only vending machines in hospitals and clinics, but also the food outlets that are available in and near clinics. A lot of fast food options and not, the healthier fast food options that are starting to come about today. But I think, yes, accepting EBT cards is a huge, huge thing. Unfortunately, SNAP, and I am not 100% sure about WIC, but SNAP does not is not accepted for any ready to eat pre-made foods, but certainly as in pre-made meals, but certainly just having healthier vending machines, having fruits in vending machines, having you know, whole grain crackers or whatever it might be, things that are healthy. And you know, if it's a dialysis unit, making sure that we've got kidney friendly foods in there. I think that's a great way that you could, even internal to your organization, make some really wonderful changes.
And then finally, we have a question from Mary Funsmith, rather, and she says, are the clinics that are mentioned of the coalition you mentioned earlier?
Yeah,
Are there
absolutely.
clinics?
Yes, there are everyone from healthcare organizations, community coalitions, universities doing research. It's a really, really wide array of folks, and that I think is really great. And they bring in speakers from, you know, clinics or food pantries or whoever to talk about the programs that they run as well really frequently. And so it's a great place to make connections.
Thank you.
Okay, do we have any final questions for Emily? All right, Andrea, do you want to go to the next slide? All right, well, your feedback is definitely appreciated. If you would like a certificate of completion for this learning session, please complete this evaluation, and we have the link here. We'll also put the link into chat for you. In addition, it looks like Nicole has also posted in chat the link to our slides for this learning session. And even if you don't want a certificate, we would love for you to complete our brief evaluation. We do have some final polling questions for you as well. So we'll go ahead and post the first one. And the first polling question, while Jerry is putting that up for you to think about, oh, there it is. I've learned something useful in this session. And overall, how satisfied were you with the information provided during today's webinar? So I'll give everyone a few moments to complete that. All right, we'll just wait just another minute here. All right, thank you everyone for your feedback. This is absolutely wonderful. And then this will help us too as we develop future content. All right, next slide. We would love to continue the conversation with you. Superior Health has a, I call it our Superior Health Facebook, but it's a shared learning environment for Superior Health participants. We encourage you to sign up. It's a great learning environment where we post additional information, and you can also post questions to this site as well that we can assist you with. Next slide. We also offer other Superior Health services. What we have going on right now is a free on-site mobile vaccination clinic and health fairs. And if you would like to learn more about this, we have some contact information at the bottom of this slide. But as you can see, we have a variety of topics that we do promote with health education during the health fair and COVID vaccination clinic, including self-measured blood pressure, chronic kidney disease, safe opioid use and substance use disorders, dietary resources, cancer screening, mobility resources, tobacco cessation, and additional information as well. Next slide, please. And just as a reminder, we hope that you join us in July for a discussion on tobacco cessation, and then again in August as we discuss immunizations. Next slide. So next steps, if you've registered for this learning session, you should be registered for future webinars, but we encourage you to share the registration with others. Also, if you get the opportunity, please sign up for Superior Health Connect. We'd love to continue the conversation. And if you have any additional questions, or we do offer one-to-one assistance, please email Jerry and reach out with any questions to her. Next slide. So that concludes today's webinar. Thank you so much for joining us, and we hope that you enjoy the rest of your afternoon. Bye, everyone.